I am thrilled to welcome Dr. Jennifer Mercier of Mercier Therapy today for my Nourishing Body, Mind, and Spirit podcast. I first heard about you several years ago. A massage therapist I know was planning on taking a course with you because of your specialty with fertility. And I got very interested. I've been following you for years now, ever since then, and watched a lot of your videos on YouTube. And I'm really kind of blown away by your background because you have tons of experience and education in all these different pieces that most people don't have. So I'm hoping that you could just share with the audience real quick, what is your background and what led you to developing Mercier Therapy?
Sure. So let me start by saying thank you, Dr. Nancy, for having me. And also that I didn't get married until I was 35. So I had my first baby at 37. So I had many, many years to enjoy different programs, educational programs, and going to learn from amazing midwives around the country. Plenty of time to do that. So again, thank you. I started out training undergrad to go to medical school. And I decided at very last year of undergrad that I was going to go to a massage therapy program at the Chicago School of Massage. And that was in 1994. And I finished that program, and only to learn about bodywork for the childbearing year, which was a training in prenatal massage with Kate Jordan. I became very interested in her section of talking about doulas and midwives. And I thought, oh, wow, that sounds like a place I need to be. And so I tucked that away and finished up my undergrad degree and my training in massage therapy in 1996. I decided to apply to medical school, which I did, Spartan University of the Health Sciences in St. Lucia. So I applied to a Caribbean medical school because the tuition was far more manageable. And secondly, I didn't have to take the MCAT to go there. I didn't want to take the MCAT. I don't believe in standardized testing. I don't think that shows the full aptitude of an individual. So I just didn't want to take it. And I was accepted to Spartan University. And then for whatever reason, I decided, hey, I want to become a doula first and see what that feels like. And with my full intention of always going to medical school, doing a residency in OB-GYN, and then doing a fellowship in reproductive endocrinology and fertility. I kind of put that on a bit of a hiatus there to become a doula. I trained with DONA, Doulas of North America, and ALICE, the Association of Labor Assistants and Childbirth Educators, and worked as a doula for probably 6 months to a year, in a hospital setting mostly. And while I liked it, I felt like something was too forced and too manipulated and too indoctrinating to expectant mothers and parents, that just didn't feel natural to me. Lots of interventions, and I felt like there was something off. And so I said, well, you know what? I think I'm going to train to be a midwife. So I trained at Casa de Nacimiento Birth Center in El Paso, Texas. I also trained at the farm in Summertown, Tennessee with Ina Mae Gaskin,
Awesome.
Deborah Flowers, Pamela Flowers, Deborah Hunt, Pamela Hunt, Deborah Flowers, Joanne Santana. And that was a really amazing experience. I also trained with Sherry Daniels Rosenbaum down at the Miami Beach Maternity Center. So I traveled a fair bit to experience how different midwives did things, and trained by apprenticeship, and was a midwife for 12 years, home birth midwife, practiced in a home birth setting, hospital setting, birth center setting. Also went to Jamaica and trained at the Victoria Jubilee Hospital in Kingston. So that was a neat experience.
So I want to interrupt you for a second. So
yeah.
I actually know a midwife who also was at that place in El Paso. And I remember her telling me that their cesarean rate was like nothing. And
very low.
Yeah. So, and I think the cesarean rate in hospitals is like 40 to 50%.
It is.
Yeah. So that kind of tells you that it's possible to have way more vaginal births than we currently have in this country. And, so she had trained there. I think she was there for like 9 months and had
Yeah.
incredible experience. Now she's in a hospital setting. I don't think she has any desire to do home birth, midwifery, but she brings something to her clients, that she sees in the hospital. When somebody wants a natural birth, they get put with her because she has that skill set to take them, whereas the other midwives that have been trained just in hospitals don't. As you said,
Yeah.
that even with doulas, we're seeing, I know years ago there were two different major doula groups, and one was definitely more trained in all those interventions and definitely had more of a medical approach than the other doula group. I don't know if the other one still exists, but I remember that from years ago. Because I don't know, you probably don't know this about me, but for a long time, my practice was 50% prenatal and
Okay.
40% babies and toddlers. And I lived in Asheville for 6 years, and I was one of the presenters at the Asheville Birth Conference for 2 of those years. So this is something that I really care about. So seeing the difference with people that have this, mindset going into a birth really does make a difference.
Very much so. Yeah,
Yeah.
very much so. And to the fact that you brought in your friend who's a midwife and she trained at CASA, but is also hospital based now. There is a different facet that she's bringing to her clients. Most of the clients that we had at CASA would come over the border from Juarez, Mexico, and have their babies with us. And those ladies could birth their babies. I mean, wow, they were incredible. And I mean, I feel so blessed and privileged to have experienced birthing with those women. But they really had it right on. Like they'd come in active labor and they'd labor a little bit, labor down, and then come into a birth room and have their baby. And I'm not saying that we should be risky with birth. We shouldn't be. I mean, there are two lives there that matter very, very much, and the outcome is very important, that we've got healthy mom, healthy baby at the end. And there is a need for C-section when it's necessary. I think, inducing, I'm getting off on a little tangent here, but most OBGYNs are inducing women. They're inducing their labor well before baby is engaged into the pelvis. And when you do that and you rupture someone's water, then you have chance of cord prolapse if baby is too high, or you've got a baby that's just not ready to be engaged in the pelvis yet. So therefore, there's minimal pressure on the cervix to efface it and dilate it. And then baby gets into trouble when mom gets an epidural, and the mom's maternal temperature spikes and her blood pressure increases, and then they take the baby away after birth. And most of those inductions, and I don't know the exact statistic because I'm not really in that world so much anymore, but most of those inductions end in section because of failure to progress. It's
But
really failure for the provider to be patient.
right. And I think part of that is that when you go to the hospital, they immediately ask, are you going to want, an epidural? What kind, so they're already kind of like setting up the mom for a medical birth, right? Because, one of the things that drives me crazy is the way we've just lost how to be in touch with our intuition, right? So we give that power over to the doctor, to the nurses, rather than having people support us and listen to what we actually need or want.
Yeah, I agree. And I really do feel that that portion of the listening is lost. I do feel that it's lost. And I think the only way to bring that back into hospital settings is to retrain our professionals. And let me just tell you, they don't have the time. They don't have
Right.
the time to be retrained. They already know what's in their tool bag. And that's what they use. And they rely on nursing staff to deliver the care to the patient. Therefore, they're kind of removing themselves up until the end point when the baby's born. They rush in, catch the baby, finish up the delivery with the placenta and sutures if necessary. But they don't have time. And going into obstetrics, or choosing to go into obstetrics and gynecology, is really a heartless, or I should say a selfless choice. I mean, you have to go in knowing that you're going to be up and on call a lot. And that can be very challenging if you don't have a good partnership with other doctors or other midwives that can kind of take over for you when you get tired, or, if you're at a wedding and maybe you can call your partner to come in and stand in for you. If there's not a good partnership there, and a good understanding that we're all in this to help each other for the greater good, the outcome of the baby and the mom, then the translation of let's give this woman the very best options, the very best for her baby, it becomes lost. And it's so unfortunate.
Yeah, and it's kind of interesting when I had my daughter at the age of 45. She's my only child. And it turns out I had too little progesterone. I mean, this is kind of crazy. I wanted a child, but I kind of figured I'd let nature take its course. I didn't look to do any interventions. And then what happened was when I was 44, I had developed like horrible memory problems. Like I thought I was having early onset Alzheimer's. It was so bad. I would bump into patients at like the market, and they looked familiar, but I had no idea who they were. And I had always been very sharp. I remember bumping into a massage therapist who worked in my practice for 3 months. And my husband was with me. I'm like, God, she looks so familiar. And it horrified me. So I wound up going so I was in Asheville at the time. I went out there was 2 natural pharmacists in town that, I trusted. And if I ever need anything, I would go to them because they would always recommend supplements first. And I was talking to one of them. He goes, Nancy, it sounds like you have low progesterone. And he goes, have you had any other issues over the year? I'm like, yeah, I had endometriosis. I had horrible menstrual cramps, PMS. He goes, oh, you definitely have a problem with progesterone. I started taking the progesterone, and 6 weeks later, I was pregnant. I mean,
isn't that awesome? That's awesome.
It was crazy because
Yeah.
my then partner at the time, who's now my husband, we were having a lot of problems, and I was like wondering if the relationship should even go on because we were having so many issues. And I took that as a sign from God that it was time for me to settle down, and because I'd never been married. Okay, Nancy, and here it is 20 years later, or my daughter's 17, so 17 years later, and we're still together, and we've done a great job co-parenting. He's a great partner, but it was interesting how, you just don't realize all the pieces that go into that, and listening, my intuition told me, oh, I need to go see this pharmacist because I think he'll do the best job of guiding me rather than running to the medical profession. And, who knows what they would have done with me.
Yeah, it's true. Yeah, lots of tests, I'll tell you that much.
Yeah.
Lots of tests, and they probably would have told you, even at your age of 44, that you are just too old and you'll probably need an egg donor. And look at how the body just knows. Once you add back whatever has been missing, it's like a puzzle when you leave a piece out of it. You put the puzzle piece in there and it's like, oh wow, there we go. Everything is all set. That's what progesterone can be for most women. I think progesterone is magic and beautiful, and I use it all the time for myself, but I also use it in my practice because I'm a bioidentical hormone specialist. So I love using natural hormones to help create balance. It can be life-changing as you experienced.
Yeah. And so what happened was, because of my insurance, I went to a more medically oriented midwife. I knew I wanted to be with the midwife group, but they were in a medical practice, and they wanted to do all this testing, and they wanted me to get an amnio, and like, again, my instincts told me my child was fine, but they used so much emotional blackmail to get me to get this amnio. I was so firm, but my husband, on the last possible week we could get the amnio, they said to him, well, if you have a child with Downs, like 50% of marriages failed because of that. And that was it. Like, he's like, you need to get this. And even though I knew in my heart, like I listened to my heart told me my daughter was great.
Yeah.
So I wound up getting it. And it turns out she was great. But also they had him do, so I'm Jewish. So they had him do a Tay-Sachs test because I'm positive, I'm a carrier. Even though he's got he's Irish and German and English, and it was just so unnecessary. And anyway, so I wound up leaving the practice and paying out of pocket to go to a practice that would really take care of my needs. So they did home birth and hospital births. Because of my advanced maternal age, they still recommended a different hospital than the one most people went to. They had a big tub in the room, and I could tell you, so I went to the hospital at like 10 o'clock at night. I remember 2 a.m. looking over at my midwife sleeping in a rocking chair. She was there for me the whole night. And I had a doula too. So, when you talk about the OBs just coming in at the last minute to catch the baby, how can you do what's best for your patient if you're just popping in like that? And that's what's so great about having a doula.
Agree. Yeah. I mean, popping in like that at the end, you really don't get a good sense of what this woman is like and how she's laboring down. And I mean, case in point, there was a friend of mine who got pregnant a little bit later in life as well. She met a man, and she'd already had a 9-year-old son, and they got pregnant rather quickly. And then she said, "Can you monitor me at home?" And at this point, I was newly pregnant with my son, and I said, "Sure, let's do it." So she was due fairly soon into my pregnancy. I was 18 weeks, and so I said, "Sure, absolutely." So she calls me and says, "I think I'm in labor." And then she hands the phone off to her partner, and he says, "She's in labor." I'm like, "Okay, well, come over and we'll check the baby and see what's going on." And certainly she was laboring, but she wasn't active quite yet. And I checked her, and she was at 4 or 5 centimeters. And baby sounded reassuring on the Doppler. And so she labored. She was in the shower and she labored, and I was there. And about 2 hours after that, she started. I'm like, okay, so then let's get going to the hospital. And so we did. And one of the doctors that I know well was her doctor, and he wasn't quite there yet because we got there and she was almost complete, and got her, laboring at the side of the bed, rocking, holding onto the bed. And finally she said the baby's coming. And so she got up into the bed, and the doctor walked in. He said, "Let's get her feet up in the stirrups." And I looked at him and I said, "No, she has a history of sexual trauma." And he said, "Okay, no problem." But honestly, he should have known that, right?
Right.
He should have known that because she disclosed that to him in her prenatal care. That's big. And I'm not shaming him whatsoever for not knowing that, but I mean, he's got so many patients, but that's still something to be noteworthy of. And so he let her labor down and have the baby in the bed with no stirrups, no foot pedals. And it ended up being a really beautiful birth. I mean, she had her baby within 20 minutes of getting to the hospital.
Wow.
And she was 45 as well when she had her daughter. So those are crucial points to know of your patient. If there's something in their history that would preclude them from, engaging in a certain ritual that the hospital has in place. It's important. It's important to know your person. So I love that your midwife was sleeping in her rocker while you were
Yeah,
laboring. That's
it was
great.
so great. But, I think the other issue is that a lot of these practices are so big that,
Yeah.
it's not like a small family practice where you see, certain doctors all the time. With these large practices, I think that doctors don't get a chance to really get to know their patients because, from what I hear, because I didn't go to a practice like that, it's like, every time they go for a visit, they're seeing another doctor because they want to make sure the patient has seen all of them. And I understand, maybe these are difficult times for people to have small practices. They're juggling a lot. And I'm not trying to, judge them or be shameful, but I think that's another reason why it's essential to have a doula if you're not someone who wants to use a midwife, right?
Agree.
You
I
want
agree.
someone, and you need to be able to connect with that doula. I know a lot of doulas, and the person I chose was someone who I became friends with rather than some random person. I think it's important that you feel like that person's got your back and knows what you want, right?
I agree. Oh yeah, I agree. And I don't think the fact of a birth plan has to fly out the window and be laughed at. I think if you do have a great doula, and I recommend every woman hospital, laboring in a hospital or at home needs a doula.
Yeah.
Because the midwife is not the doula. The midwife can be very helpful and very caring, but the midwife's ultimate, job is to carry out the management of the labor and the delivery. And so that's where a doula can come into play and be very helpful, just as you know. But yeah, I refer to doulas all the time. I've got some really great ones in my back pocket. I love these ladies. So yeah.
If you think about it, this past year and a half, how many stories have we heard about women going to the hospital not where their spouses aren't even allowed in, let alone a doula? And like I'd be very curious to know if the cesarean rate went up the last year and a half because they
I'll
did
look
not
into
have
it.
that support. What's that?
Yeah, I'm sorry. I'll look into it. I'll see what I can find. That usually stats are a couple years behind, so I'll see what I can find and I'll report it back to you. And or if you find it before me, let me know. But I agree with you. I think that the way that we dealt with this is hideous. To not allow partners in the delivery room and then to make women wear masks while they're delivering a baby.
Right.
That's I mean, that's like running the track and wearing a mask while you're running the track. It's
Right.
absolutely uncalled for, especially if these women are having COVID tests prior, or rapid screenings while they're in labor. What's the point of wearing a mask while they're laboring? It's insane.
And just being around people that are masked up, we know that masks increase stress levels, right? We know that.
Yes. Yes.
And like I know that if I go to a store and I have to talk with a mask on, I have to talk loudly, right? Just so the person can hear me. So for me, like I think birth is one of the most important things to feel nourished. I mean, we need to feel nourished all the time because there's so much stress out there. Even before the whole pandemic, there's a lot of stress, but even now it's just so much worse. And we need to take extra measures to nourish people. I think having a doula is essential. I see more and more women. I have a natural parenting group in my area that I run. It's a Facebook group. I see more and more women now looking for home birth midwives, and I'm thrilled because it's birth is one of the safest things you'll ever do. It's only when we start all those interventions that
Right.
there become issues.
Agree. I agree with you. And I do see the same as well. Women looking for more alternatives, even birthing centers to have their babies as opposed to, going to the hospital to have them. But again, I don't want to scare women from having a hospital birth if they need it. If they have
Sure.
some sort of, preeclampsia, or if they've got some sort of baby with a genetic issue on the way that's, going to need some support after birth, just have your doula with you for sure. But also full well knowing you're going into an atmosphere where it's a very controlled environment, and you are very much probably not going to be heard. This is where informed consent comes in, right? So we need to have all of the options available to us and then sign off on that consent, to give our consent for something to be done to ourselves or our babies in the hospital. So I think going in as a wise consumer is really going to behoove you, and having your ally, your doula ally there, and then your partner, all on your side, and everybody just working in concert together to orchestrate the final outcome is a healthy baby, healthy mom, is going to make you all the wiser.
Yeah, and I think also if you know, are doing a medical birth, it's important every time you meet with that doctor or series of doctors, you let them know up front, this is what you want, rather than waiting till like near your due date, right?
Yeah.
So try to formulate ahead of time what it is you are looking for in your birth, right? What do
Yeah.
you foresee? Do you foresee a water birth? Do you foresee, being able to move around? Whatever it is, I think it's important to convey that. So first of all, they have it in your records. And secondly, that when they come there to show up to deliver your baby, hopefully they'll remember.
Yeah, that's the hope. And I think, being an assertive yet kind consumer is important too. You have to say what you want.
Yes. Yeah.
And then you have to have your advocate saying what you've discussed and what you want as well. I mean, you can't go in there and be afraid or scared of what they're going to say to you. You have to say, hey, listen, I want to delay the cord clamping, and I want to take my placenta home with me. And these are things in retrospect, like these were things discussed. But if you don't know these things about me, I would like you to bring the consent form in here and allow me to sign off on that right now before I get heavy into my labor and forget to maybe mention this to you. And thank you so much for understanding. I really appreciate that. End it with that, because a lot of these nurses now too, and I love nurses and God bless them, but they are being indoctrinated or have already been indoctrinated into this medical propaganda of get the vaccine. And that's the only way that things are going to end this pandemic, and that COVID is very, very dangerous to pregnant women. And, that's what we're reading. That's what we're reading, and that's what we're led to believe. But we don't have any long-term significant data to suggest that indeed is 100% truth. I don't think we'll ever get 100% accuracy in our data. There's always going to be some sort of skew or bias. But if you look at, for me in my own practice, 6 women that got pregnant with my treatment went ahead and all developed COVID, and they had COVID while they were pregnant, and they all recovered because they got ivermectin. I know that's very controversial, but they all had all 6 of them had ivermectin. They started it early at the onset of symptoms, and they all were able to be COVID recovered by the time they delivered their babies. And so now when they nurse their baby, these babies will have true herd immunity. And I believe that with all of my heart. I studied virology. I studied immunology. I know the transmission of antibodies from mom to baby are very helpful in baby creating antibodies. So I know that's a different discussion for a different day, but I feel like we have to touch on it a little bit, because there are so many women that are being frightened into having the vaccine while they're pregnant. And I just, I would just encourage you, not from an anti-vaxxer perspective at all, and your body, your choice, you do what you feel best for you. But when these doctors and these OBGYNs and reproductive endocrinologists are telling women that have fertility challenges, get the vaccine, it's safe, it's the only way out of this pandemic. Well, I wholeheartedly disagree. I think we don't know enough. And I think that, maybe 5 years down the road, when the virus has completely wrung itself out and it's not even an issue anymore, we might have the data then. But to go ahead and be remiss about getting it right now and going to get it because well, these teenaged girls are getting it. My babysitter wanted to get it. And I said, so what's your purpose in getting it? And she says, well, every one of my friends are getting it. And so therefore it becomes a trendy thing. Oh,
Right.
I got it. Look at my arm. I got it. It's trendy and it's on social media and these kids don't know any different, but these parents aren't teaching them any different either. So, I mean, my babysitter, lovely 16-year-old girl, we were taking a walk the other day and she's standing in her garage with her parents and they were like cleaning something out and we went walking towards them and she goes, hold on a minute, I have COVID. I'm like, oh, okay, that's okay. And the parents both said, yeah, we've been vaccinated. I said, well, these vaccines don't stop viral transmission, so you can still get ill. And they said, oh, you can? And I said, yeah, nobody told you that? And they said, no. I said, okay. So about 4 days later, I checked on my sitter. I texted her. I said, how you feeling? She's like, I'm fine. I just have a drippy nose and a headache. I'm good. And she said, but both of my parents have COVID. I said, exactly. It doesn't stop viral transmission, but that's okay. I mean, that was the choice that they made and so be it. But I think people need to educate themselves more on this for at least what's available out there at this point, and then make a decision for themselves. But, if you look at the historical data of vaccines, and here we go off on this tangent, and I'll take one more second of this time, but, if you look, it typically on average takes 10 to 12 years to roll a vaccine out to a human population. And here we are only 9 months in. After this vaccine has been released, these vaccines, I should say, have been released. And so we haven't really, we haven't studied a phase 4 clinical trial. Phase 4 clinical trial is what's going on right now. People receiving the vaccine are in the trial, and people that are not receiving the vaccine are in the control group. So if you keep that in mind, that could bring some perspective. And still, again, I'm not telling you what to do. You should do whatever you like. I'm not giving you any medical advice, but just make good, wise decisions for yourself.
Right. And I'll add on, two things is if you look at any vaccine insert that you can find online, I think it's paragraph 13.1. It says that the vaccine had not been evaluated for causing infertility. Almost every vaccine that you find online says that. So I think it's important to know that, as you said, we don't have the data to support it one way or the other, right? We don't have that data. So I think it's important to do the research, go to, VAERS, the Vaccine Adverse Events Reporting System. Excuse me while I itch my nose. See how many stillbirths and miscarriages have been reported. See how many cases of infertility are being reported. It's important to have the facts rather than having somebody just blatantly say it's safe when we don't have that data, as you said. So I think it's really important to get that data. But also, I just really want to encourage people to, again, I'll say this again, to start listening to your intuition. And it might be, starting with something simple like, should I go swimming today? Like, does your heart feel tight and closed off, or does it feel open? That's one way that you can connect with your own intuition. If you feel yourself getting tight when someone's suggesting you do something, I'm not talking just about vaccines, but, other treatments, does that feel right for you? Because we're all individual. There's no one size fits all.
Right.
We should never think of medicine as one size fits all, because we all react differently to things. For instance, I have the genetic mutation that doesn't allow my body to process heavy metals. So I'm going to react differently to a vaccine than someone who doesn't have that genetic mutation. There's a lot of pieces that go into this. So my point is that, it's not pro or anti, it's what's right for you, rather than what's right for me or your doctor.
Right, because it's a subjective subject matter. We're not all the same. You and I are women, but that doesn't make us the same, right? So, we have to take all of those like very basics into consideration. I may not react to something the way you react to something, or maybe there's no reaction between the both of us with what we're receiving. But it's important to just be a good critical thinker and to
Exactly.
use your intuition, as you said.
So I want to get us back on track because we were supposed to
Yeah.
talk about Mercier Therapy. Um, so can you tell the audience what Mercier Therapy is and
Yes,
how you
Mercier.
developed it?
Yeah, sure. Mercier Therapy is a site-specific, deep visceral manipulation of organs. And so we use the specific sequence in which to move the uterus and the ovaries. We're making the tubes move as well, while manipulating the uterus and the ovaries and all of the surrounding structures in the bladder, such as the rectum and and the musculature, the fascia, ligaments, to overall optimize function, to bring about whatever it is we're looking to do. So if it's healing from a trauma of some sort or a surgery, or it's a fertility issue, this work has been really amazing in doing great things for all three of those categories. I specifically created this Mercier Therapy sequence out of a personal need. I was diagnosed with stage 4 endometriosis in my early 20s and needed a pain management solution, other than Lupron, which would put me into a temporary state of menopause, or oral contraceptives, which gave me the worst headaches of my life. And I gained so much weight and felt terrible about being on oral contraceptives and just all of the terrible side effects that came along with it. I kind of started poking around in my own belly, and it was really painful. I had 3 surgeries to clear up the endometriosis, and each time I had a surgery, it was more and more challenging to recover from. But I didn't back off when I felt that sensation, that painful sensation deep in my pelvis. I just kept going, and I thought, this is such an interesting methodology that I've kind of stumbled upon. It was like a direct download from God saying, do this. And when I had my next menstrual cycle, after I would work on myself, there was no warning that it was coming. So no cramping, no breast tenderness, no headaches, no spotting like I was accustomed to. It just started, and I had no cramping during my menstrual cycle. Whereas before I would be having to take a lot of Advil to cope and to be able to work, or if I was working or if I was a student back then, it was wretched pain. And I considered myself to be pretty tough, but that was something that I wasn't looking forward to on a monthly cycle. So I was able to help myself. And then I thought, you know what, why don't I write a curriculum and actually write a sequence and start teaching other professionals how to implement this into their practice. And that's exactly what I did. And that was happening about 2004, 2005. And then in 2006, I taught my first Mercier Therapy class. And it was fantastic. One of the participants who took the class, she was not able to conceive because she wasn't getting a period. And we were thinking that she had hypothalamic amenorrhea because she had not had a period for a long time. Well, while driving back to Wisconsin, she started bleeding. That's where she was from. She had not had a period in over a year, and she started bleeding after the training because we work on each other. And I said, okay, that's great. And she's like, no, it's like a hemorrhage. I'm scared. I said, that's okay. Let yourself bleed. And I put her on some iron and had her really hydrate. And she came out of that just fine and started having regular periods again and was able to have a baby. Thank you, God. And then another gal in the class, she was not able to conceive, but after the class, she went home and conceived. And I thought, oh my gosh, this is really real. And I never really doubted it, but I also was asking God for a confirmation. And this was the confirmation I needed. So that set it into motion. I started practicing it, putting it into my practice. I kept working on myself, and I kind of lagged on myself for a little while, to be very honest with you, because I just got real busy. But then by the time I'd gotten married, we were having trouble. And for a good year, like nothing was happening. And I thought, okay, you know what do I do here? I have my students find my uterus and ovaries. And they did. And that cycle we conceived. And it was like, okay, that's right. Duh. And it was awesome. And so ever since then, in 2006, I've been teaching stateside here in Illinois, and then also in the EU. I just did a teaching last month in Croatia. It was amazing. Some five countries represented: Australia, Switzerland, Germany, France, and Holland. Sorry, Harmon. I didn't mean to forget Holland in there. Harmon is my guy, my only token guy that came from Holland, the Netherlands, to take my training. But we had a great time. And I always know that everyone in my class that attends is supposed to be there. There's no way that that person isn't supposed to be there. It's like they're just led, and we train and we have a nice time, and they implement this into their practice, and it just goes really, really well.
Yeah, and so one thing that came to mind as I hear you talking is I wound up having a cesarean. I labored for 16 hard hours. You know, it's fully effaced, fully dilated when I got to the hospital, but she never descended. And unfortunately, I had been put on bed rest for the last month because my blood pressure went up. And because of my advanced maternal age and my history of endometriosis, my midwife felt like I really needed to be put on bed rest, which later I realized after I had my daughter that my sacrum had just locked up from me lying around all day long. And but you know, I really had a lot of problems after the cesarean with incontinence. And I went to someone who did cupping, and that helped me tremendously. But I also think that something like this would have helped too.
Yeah. You mean with the C-section and the like in recovery?
Yeah, the scar tissue from the cesarean.
Absolutely, because scars from C-sections look most times pretty beautiful on top, but then underneath the scar is like an iceberg. It extends far and wide. There's a lot of structural involvement there, and it's best to get in there as soon after the C-section scar has recovered as possible. I like to say before 5 months postpartum, to get in there and just really get working is going to be the most crucial to do. So.
And I have to tell you, it's, you know, at least from my perspective, it wasn't pleasant, you know, having the scar worked on. And I've since worked on other people's scars. But, you know, I was watching the video you did. I definitely don't get in as deep and as comprehensive, but just getting in and working directly below the scar, it's tender, but it eases pretty quickly. You know, that tenderness eases pretty quickly, and you just feel so much better down there.
Agree. Yeah. I actually had 2 C-sections too, Nancy.
Oh, you did?
I'm the midwife that had 2 C-sections. Yeah, I was very prepared to have my daughter at home. She was my first, and had the tub, had all my box of supplies, my great midwife and doula, all ready to rock and roll. And at my 39-week and 6-day prenatal visit, my midwife said, she checked me and she said, "I think I'm feeling soft parts down here. Let's do an ultrasound to confirm." And sure enough, she was breech. And we tried Webster's. I tried like a spinning babies approach, because I had trained with Gail Tully long ago, and I remembered, you know, some of the movements to do, but she was really wedged up there, and I ended up having a section. And then with the second baby, I tried a VBAC, and by that time I was almost 41. And they were treating me like I was a precious little egg that would break at any time, because I was so old, you know. But in great shape. I mean, my blood pressure was always good, and I always, you know, I ate really well, and just stayed hydrated. But I went into labor with Seth at 38 weeks. My water ruptured on its own. I took my time getting to the hospital, and I labored for 16 hours like you, 16 hours. And I remained at 4 centimeters with him very, very high. And my spidey sense, my intuition, my midwife's intuition said, it's probably time that we take this kiddo. And when we did, he had double nuchal cord, so tight around his neck, and it was a short cord. So he wasn't going to come down. And I thought, okay, well, good call. Take your intuition and run with it. And he was born 7 pounds, 13 ounces, very healthy. And I recovered from that one well too. But I do work on my own C-section scar. And it's quite flat and gorgeous. And I feel like there's minimal adherence underneath any longer because of all of the work I've done. But certainly cupping is great over the scar. It's great. And it can influence underlying scar tissue too, to not be so gritty and connective and like glue in essence. But yeah, I keep working, keep doing whatever you're doing.
So I want to get your opinion on IVF, because the people I know that have done IVF, it just seems like it's very hit or miss. But again, I'm not in that world. Do you have an opinion on that?
Yeah. So when I was doing my undergrad training, I worked for the first 2 years of my undergrad. So I was 19 and 20. So for 2 years, I worked for the Center for Human Reproduction, and I was a clinician there because I wanted to become an REI, and I wanted to do IVF, and I wanted to help women get pregnant via medical methods. And during my work there, I was trained to do pelvic ultrasounds and lab work and semen analysis, IUIs, intrauterine inseminations. I monitored IVF cycles from start to finish. I went into retrievals and transfers. And so I speak that language. So thank you for asking. IVF is, in my opinion, very overused, and is also a blessing for people that really need it, for women that really need it. When you look at IVF statistics, they're not very good, and you can find them yourself at SART, SART.org. Again, that is preliminary data, which is always 2 years behind. But you can make an average of the numbers yourself and see that there's about a 23% success rate across the board for IVF cycles. Whether it be the first, second, or third, typically women get pregnant maybe on the third IVF cycle. And I do believe that's because of the insurance coverage. They want to use the first, second, and third cycles to their benefit. And we're talking about a $20 billion industry here. So if that gives you any idea of why IVF is so much used, it's mainly because there's a bottom line to fulfill, and there's a lot of money to be made in assisted reproductive technologies. There's a lot of hope that is instilled in women by reproductive endocrinology and fertility specialists by saying, let's get you pregnant. Therefore, the woman drops her burden at the door, walks in, and allows a team to manipulate everything for her. I think that's a very dangerous process, but we also want to include the husband or partner and not decouple them. And that's what IVF does. So if you have a very strong couple and they're working together on all facets of their relationship, their financial relationship, their psychological relationship, their emotional relationship, I think it can be really a good thing. But I'm not, I was told I needed IVF because everything in my pelvis looked really, really not good condition. And I said, I'm not doing IVF. But again, that's up to the individual to research it, to become a wise consumer, to learn about all of the working parts of IVF. But I see a lot of failures, and then women come back to me and they usually get pregnant on their own. But I think we need to instill some patience because just because you're a school teacher and you want to have your baby at the beginning of summer and have the whole summer off with your baby, and that's not happening for you, that's just not how it works. It's not our time. It's not our timing. It's God's timing. And if you're not a believer in God, well, then there's really no one to be accountable to, for feeling that way. So I understand that you want to have a baby 2 weeks ago. I understand that sort of feeling. I was in your shoes, but really we have to kind of sit back, monitor our cycles, have good assistance from professionals that, will stand next to you on the journey. And that's exactly what we do in Mercier Therapy. But IVF isn't something to be taken lightly. It's certainly not something to be jumped into quickly. And there are definitely other things medically that we can do prior to going to an IVF cycle.
So I realize I need to have a second interview with you because we didn't even get close to covering all the things I want to cover, but I also want to be respectful of people's time and be able
Sure.
to pay attention. So I'd like to end by you just sharing how people can reach you, how they can find you, how they can get more information, because you're very highly regarded in the fertility world, as well as, in other aspects. So I want to make sure as many people find you as possible.
Thank you so much. My practice website is expectamiracle.life. And my website for, if you'd like to come and train with me, is merciertherapy.com.
And where are you located right now?
I'm right in a suburb outside of Chicago called St. Charles, Illinois.
Okay.
It's a very pleasant little place. So if you come and train here, there's great little Airbnbs and restaurants, and everyone who comes here always has kind of like an experience of a vacation, but also a training. And my training is very interactive. It's small groups, which I wouldn't have it any other way. For me, it's not about making tons of money. It's about making sure that these professionals leave my training well educated. And we always, share nice meals together and talk, and no questions off limit. You have me for a full almost week. So ask me whatever you need to ask me, and enjoy the training. And please walk away from it wanting to implement it into your practice and being excited about it. And that's what I love about our trainings. It's just so healing and so good, and on many levels.
Well, it's so nice to get to know you, and I appreciate you, and I look forward to talking with you again soon.
I appreciate you too, Nancy. Thank you so much.
Thank you.